Good morning. Okay, good morning, good afternoon, and or good evening. It depends on wherever you are. Thank you also for joining this webinar on Mental Health Data Prize Africa. Before I take you through the today's agenda, I would like to introduce myself. I'm Moluso. I'm a project manager for this Mental Health Data Prize Africa. I will be moderating or chairing this session. So today we have three main agenda. First, our partner from Welcome will introduce themselves and tell us a little bit about Welcome's vision about mental health and also their current activities related to mental health. Global activity related to mental health globally as well as in Africa. And then followed by our team from the African Population and Health Research Center will introduce you, probably for those of you who don't know about of the African Population Health and Research Center, they may introduce what it does, followed by we dive into the data structures. One of our project member will speak about the detailed data structure, key features of the data prize, and then followed by our IT team will show you how to sign up for the courses we have. And we will try to respond to your questions with a maximum capacity and the time we have. And we finish our session at 4. So thanks for joining again. Before I invite my Welcome team, I would like to make some housekeeping. This video is recorded and will be available in the near future, like for your reference. And also it will be fine for those of you who don't make to attend to today's session. The second one is, if you have any questions related to the Mental Health Data Prize, you can put your question in the chat box so that we will try to respond to your question. So let me invite our colleagues from Welcome. Over to you, Ekin.
Thanks, Mluzo. I think my colleague Winnie is going to share our presentation slides, and then she'll kick off and I'll take over.
Yes, thank you, Ekin and Muluzu. So my name is Winnie. I work in the mental health team at the Wellcome Trust, and it's absolutely fantastic to see so many of you tuned in today. I thought it would be helpful to start by giving a little bit of an overview of the Wellcome Trust and the research strategy we have. So the Wellcome Trust is a research funder that generally funds science into life, health, and well-being. And the majority of that funding actually comes from what we call discovery research, where the projects are curiosity-driven, where researchers basically can apply with their own project in mind, as long as it is about increasing our knowledge of life, health, and well-being. However, Wellcome then also defined 3 strategic areas that we sort of identified because these are major health issues facing us all at the moment, and is also something where Wellcome sees itself well placed to make an impact. And this is infectious disease, mental health, as well as climate and health. And mental health in particular was chosen as a strategic focus because the burden of mental health is growing globally, and actually predicted to be the biggest burden by 2030. Mental health conditions also typically start early in life, which means they will have very significant implications for an individual's life trajectory and potentially very severe social and economic impact. Some of these mental health issues will resolve without intervention. However, many will become a lifelong progressive condition with relapse rates in the very high numbers. So at Wellcome, our vision is to create a world in which no one is held back by mental health problems. And we want to achieve this by creating a step change in early intervention in anxiety, depression, and psychosis. So we define anxiety, depression, and psychosis very broadly and include all types of anxiety and depressive disorders in that. So this includes, for example, obsessive compulsive disorder, OCD, as well as post-traumatic stress disorder, PTSD, and all forms of psychotic disorders, including schizophrenia, postpartum psychosis, and bipolar disorder. So even though we define this very broadly, we did feel that having some sort of focus is important so we can actually make a real impact here and not just kind of spread ourselves a bit too thin. And we chose depressive disorders, anxiety disorders, and schizophrenia in particular, because as you can see from this graph here, this is where the majority of the burden actually comes from. So here we can see the years of life impacted by depressive disorders, anxiety disorders, and schizophrenia are particularly high. You can also see that these conditions start very early in life, especially anxiety and depression, which means that this will have a really big impact on people's lives. And it might mean that it will hold people back from fulfilling their life's potential. Interestingly, I thought was also that at this graph, you can see that it's a bit of a gender issue as well, with females almost twice as likely to be affected than males. Now, to make an impact, to actually create a step change, as I said, we believe that it is critical to also involve people that have lived experience of these mental health problems. And we at Wellcome define lived experience as a unique form of knowledge, insight, and expertise that comes from having experiences of these mental health challenges. We believe that lived experience perspectives are absolutely critical in designing and conducting research, so that this research will actually have the potential to make a meaningful difference to those that are affected by these problems. At Wellcome, we work with a large team of lived experience advisors that you can see here on the right. And these are from all sorts of global locations, because obviously the experience of mental health problems will depend on your local as well as your cultural background. And so when we look at the map of the burden of mental health problems, we can see that this is truly global, affecting every region in the world. However, it appears that there are some countries, for example, also here on the African continent, that report a lower burden of mental health problems. However, we know that a lot of the data, especially in the mental health field, is very unreliable and that there are large data gaps that we need to address. And so what we really want to understand is there something that is going really well in these countries? Is there something that we can learn from these countries and take into other countries to reduce the burden of mental health? Or is this just due to sort of an underreporting of mental health problems and unreliable data? So we want to make sure that we can fill these data gaps and to understand these things more thoroughly. To illustrate this research gap a little bit more, I just pulled out numbers for one seemingly quite simple question, which is how many children and adolescents have anxiety in certain countries. And this data is only available for 25% of higher income countries. And even more shockingly, it's only available for 12% of lower and middle income countries. This means that any research findings will then be based on higher income country populations, assumed to hold in very different cultural and socioeconomic contexts. We also have a real lack of data informed by lived experience perspectives. And we want to understand how this can be incorporated more on the African continent to make sure we get good quality data. Finally, I pulled out the number of publications in psychiatry and mental health here on the right. And I'm sure it surprises nobody that the US are topping this table. But then when I looked for the first African countries in this list, it's great to see that they're in the top 50. But if we look at the actual number of publications, these total numbers are very low. And this is something that we want to address, partly with this mental health data prize, but also with other activities that we have at the Wellcome Trust. So we have many different funding models. The data prize model, obviously, we will talk about more today. So I'm not going to go into much detail here. but we also fund large mental health awards. So these are big grants for teams of scientists to come together and collaborate on a specific question. And usually we set the theme of these calls. So the theme will come from Wellcome, but then the research teams set their own question and apply with their projects. And for example, we recently had a call for understanding how anxiety and trauma-related problems develop, persist, and resolve, with actually research taking place in lower and middle income countries as a priority, as one of 2 priority areas. So this would have included lead applicants from lower and middle income country institutions, as well as using data from this context, etc. We also provide infrastructure funding. So this is directed investment for large projects and usually longitudinal cohorts, because obviously they run for many years and require a lot of funding to keep going. And one example here is Young Lives that I think maybe APHSC might showcase as one of their examples later on. So Young Lives is a cohort study that has been running for 20 years. It operates across 4 countries, including Ethiopia, as well as Peru, Vietnam, and India. And we gave them money to increase their measures of mental health. So basically, we asked them to go back to their 12,000 participants and survey them around their mental health. And then finally, we actually commissioned a lot of smaller directed pieces of work in forms of contracts, which help us understand a sort of particular topic area. And it will also provide interesting insights for the wider field, we hope. And one example here is the longitudinal data landscaping that we recently commissioned, which was actually really interesting and found more than 3,000 data sets that had value for mental health research, including many on the African continent. And I think this might be something that my colleague Ekin will come to in a moment. And so with that, I am passing over to you, Ekin.
Thank you so much, Winnie. Hi, everyone. My name is Ekin Barukbaşı, and I am part of the Data for Science and Health team at Wellcome. And I'm looking at the numbers right now, and we have almost 300 people as part of this webinar, which I'm absolutely grateful about. So it's just so nice to see so many of you. So our team's goal at Wellcome is to tap onto opportunities offered by trustworthy data science to help solve urgent health challenges. And of course, one of our focus areas is mental health. And this Mental Health Data Prize project is very much a collaboration between data and mental health teams at Wellcome. So one point that I'd like to highlight, which is, I think, particularly relevant in the context of mental health, is that we recognize that data and technology don't exist as neutral tools. They are developed and used within a social framework, and importantly, they touch and relate to communities. So trustworthiness of data sets and digital technologies within the context of health is very much determined by how they are conceived, built, and evolved. And this is something which is very much at the core of our thinking when we are supporting initiatives in health and data. Next slide, please. So we think that data and technology can have transformative impact when it comes to mental health research, but there are also some obstacles along this journey. For example, new data sources could help identify how mental health conditions develop and how interventions affect people over time. But we do also acknowledge that the field needs large, diverse, purpose-built data sets that bring together biological, social, and economic information. And also, we lack effective diagnostic tools and robust evidence on why and how people respond differently to certain interventions. So modern methods and tools applied to large data sets could help support better decision-making and diagnosis when it comes to the management of mental health conditions. And both of these points are very relevant to what we are trying to achieve with Mental Health Data Prize Africa. Next slide, please. And I know that probably our colleagues at IPHRC will definitely go into the details of that, but in a nutshell, a data prize is a challenge-led funding mechanism that uses data that already exists and aims to build multidisciplinary teams working on digital tools which prioritize collaboration between researchers and people with lived experience of mental health conditions. And with these principles in mind, the question that we are trying to answer with Mental Health Data Prize Africa is, what can help us tackle anxiety, depression, and psychosis in Africa? Next slide, please. Thank you. While addressing the starting and somehow quite broad question, we'd like participant teams to use existing data sources from across the African continent. And as Winnie mentioned, we've already done some preliminary landscaping for these data sources as a part of our longitudinal data landscaping work. And it seems like there might be some quite relevant data sources, relevant to mental health research that may be currently under-socialized. And we'd like the Data Prize participant teams to tap onto the insights offered by those. And by the time that the prize is open for applications, we'll be in a much better place to signpost these potential data sources, as well as how participants can go about accessing them. Secondly, by getting participants across the continent to work on these existing data sources, we'd like to build where mental health research expertise and data skills, as well as lived experience of mental health challenges, are brought together to co-create some refreshed and new approaches to our starting question. So we consulted data and research communities across the African continent to understand what could be a successful way of building these multidisciplinary teams. As you know, it is something that comes up quite a lot, but building these collaborations is actually not that easy. And one area that came up over and over again was data capacity building. And I guess this is why we are all here today, to basically kickstart this journey. And if all of these ingredients are in place, which are mental health related longitudinal data sources, multidisciplinary teams to work on, and some really strong data related skills, hopefully the outcome will be ideas that will generate new data driven products or data driven insights that helps us address anxiety, depression, and psychosis in Africa. And teams with the best ideas will be receiving the prizes, which are basically the cash awards. And then they will have 12 months to go ahead and execute them. Next slide, please. So this is not the first time that we are running a mental health data prize. In fact, it's the second time. And to help you contextualize the kind of ideas that we have previously funded, but in the UK context, I wanted to share with you some examples of the teams that we have supported previously. Of course, this comes with the caveat that this is a different context and what is needed in the African continent will be different. But please take these as just examples to illustrate what has been successful in the past. So previously, we had a team working on a dashboard to produce insights on how the UK police's stop and search intervention can impact young Black people's mental health to drive some positive social changes. We have also supported, on the more technical side of things, we have also supported a team working on an open source digital tool for researchers with non-statistic background to understand how the mental health trajectories kind of evolve following intervention. And again, on the more kind of social aspect of approaches, social side of approaches, we had another team developing a digital dashboard to understand which aspects of the secondary school helps preventing pupils' anxiety. Next slide, please. So one thing that I would like to also mention is that as part of the first data prize, in addition to the UK, we've also included South Africa. However, unfortunately, we didn't receive as many applications from South Africa as we had hoped. And as a result, in the first phase of this prize, we funded 10 teams from the UK and only 1 team from South Africa. We were, of course, very disappointed about this because Wellcome is a global funder and we want to be a better global funder. So we've done some engagement with communities, research and data communities across Africa to understand why this may have happened. And this has very much shaped our current thinking for the Mental Health Data Prize Africa. And I'd love to share some of these learnings with you. So firstly, we understood that we needed a better pre-application support. And this, as I mentioned, this kind of upfront capacity building aspect of things would have been quite useful. So this is why this is now integrated as part of the Mental Health Data Prize Africa. We were told that it would have been good to have some longer timelines for application preparation, and also some support for matchmaking, which is very much on the top of our agenda with our partners, APHRC. Secondly, we were told that just focusing on a single country, South Africa, was not the way forward, and we needed better Pan-African scope. Hence, we have extended our scope to the entire continent. And finally, we realized that we needed a partner who knows and understands the local context, because we are sitting in an office in central London and we just cannot know what is the right thing to do in an African context. And hence our partnership with the APHRC, which we are very, very excited about, given their extensive outreach and expertise in population health and data across the African continent. So I am going to stop here and pass it over to Luzu, I guess. So thank you so much.
Okay, thank you, Vicky and Naveen, for your insightful presentation about Wellcome's vision about mental health and your previous experience about the first Mental Health Data Prize. So now I'll give a chance for my team. Damaso will start introducing himself and talk about a little bit about APHRC.
Thank you very much, Mauricio. Are you able to hear me?
Yes, we can hear.
Okay, thank you. And thank you, Winner Dekin, for that heads up. I will, just before I go into the presentation, I will request if the participants could rename themselves and put in maybe the institution or the country you come from. That would be very helpful for us to understand the reach of the participants of the education. So the participants and attendees, please go ahead and rename yourself and then put on at least the acronym of your institution and the country where you are located. That will be very helpful. Thank you very much. Yes, I just wanted to really speak about APHRC and of course the fact that we are grateful to Wellcome Trust for selecting and giving us an opportunity as APHRC to manage this project and the data prize for mental health. APHRC, the African Population and Health Research Center, has a vision of transforming lives in Africa through research. And I think this project fits very well within that particular vision. Our mission is to generate evidence, strengthen research, and related capacity in the Africa research and development ecosystem. And we do this by engaging policy, and we ensure that the evidence which we generate actually is geared towards informing action on health and development of the continent. So presently, we have a number of initiatives across the African continent, as you might see on that particular map. As an institution, yeah, please go next slide. Yes. As an institution, we have three main areas of focus. The three main areas of focus are the research programs. Please, okay, don't move. Okay, keep it there. We have the research programs. We have a program called policy engagement and communication. And we have another one called research and related capacity strengthening. Now, the data prize actually speaks to all these three programs that I've just talked about. But we have offices based, our headquarters are based in Nairobi, Nairobi, Kenya. But we also have a regional office that is based in Dhaka, in Senegal. Next slide, please. The research programs at APHRC, I wanted to focus on those. We have four main research programs. You can call them divisions, or, or in academia, they would be called maybe something like faculties. So we have a program that focuses on health and well-being. This really has a number of units under it that focus mainly on health. So that is nutrition, sexually reproductive health, maternal health, child health, NCDs, health systems, and so forth. The second division, called human development, focuses on early childhood development, youth and transition to work, aspects of gender and education, higher education, as well as education and technology. Another division of the institution of the center, where that is APHRC, is called the Population Dynamics and Urbanization in Africa. This has a number of working groups that relate to migration and urbanization and sustainability, WASH, aging, determinants of higher fertility, urban health and demographic surveillance. And lastly, we have a division or a program called data science and evaluation that focuses mainly on data science, data systems, as well as measurement and impact evaluation. Next slide. And all this mental health project actually that we're just going to explain a little bit more cuts across all of FHRC's programs, and I think you will get to know that more. So our vision, the vision of the mental health research work at FHRC is ideally to transform the mental health ecosystem in Africa through improved knowledge of actors, roles, existing programs, and innovations on the continent. We also focus on identification of evidence-based multi-level strategies for mental health promotion across the life course. And lastly, we hope that we can share the evidence we generate through this research and build the consensus for purposes of developing comprehensive mental health agendas and programs across the countries on the continent. So that's what I wanted really to share. I will stop there and pass it over to next slide. I think Sylvia for the proceed. Sylvia.
Yes, thank you very much, Damaso. And thanks to Akin and Winnie from Welcome. I echo the same words. We are really excited to launch the Mental Health Data Prize. And I'll just go over give an overview of the prize. We are really grateful for the partnership that is building across and also leveraging the work that already exists within APHRC. So my name is Sylvia Muyengo, and I lead the team at APHRC. So I appreciate the support and the expertise of the team members on our side in making this happen. And we also welcome the participants to this event. Thank you. Next slide, please. So in terms of the background, which I think Winnie alluded to earlier, we've seen that mental health disorders cause substantial global suffering, reduced functioning, economic costs, as well as the well-being of individuals, families, and communities that are affected by the mental health or disorders that they experience. So in 2019, about 1 in 8 people worldwide was living with a mental health disorder. And probably after our experience with COVID, we see a higher prevalence of mental health disorders, with particular focus on depression, anxiety being the most prevalent in worldwide, but also in the African region. And 75% of individuals living with those mental health disorders live in low middle income countries with no access to treatment. We're also leveraging available data within the prize for tackling the contemporary challenges that we experience in mental health science, especially in Africa. So although digital mental health innovations have gained ground and data gaps persist in the reach of these technologies, for early interventions and diagnosis, we are still far from what we would like change to look like. So longitudinal data sets could be used for tracking the progress of mental health conditions and how they manifest in our context, but those are still lacking, and we look to the prize to addressing some of the issues or most of the issues that we experience around access to data sets. And this is something that we'll be looking to support and also to reach out to potential data providers or individuals who are collecting data from public health facilities. Next slide, please. So the question that we keep referring to, and which has been raised before. How can we tackle anxiety, depression, and psychosis in Africa? So the main goal for the prize is to support multidisciplinary teams to analyze existing data sets, to generate data-driven insights, to produce tangible and scalable digital tools or outputs that support mental health research and that are tailored to the needs and priorities of the African region. So really looking at the contextual aspects and given the experience we have across the continent. So the awards, in terms of the awards, we are looking to give up to 10 awards of £200,000 each for the duration of the 12 months. So this is the period over which the teams that would lead or take the prize be able to implement their project and showcase what they have produced in terms of improving mental health conditions. Next slide, please. So some of the key components for us with the mental health data prize are around managing the prize, the data prize, and this involves us generating publicity for you to participate, but also developing a platform for you to engage in different aspects of the prize. We are also developing the landscape analysis of mental health research data sets across the continent, and then building capacity based on the experience with the previous prize. There was a lot of need for capacity building, and given the pace at which technology and data tools are understood on the continent. And then we are also supporting the matchmaking of individuals with experts from the diverse group of individuals that would support the prize, that is looking at lived experience, the mental health experts, and the data science teams. Next slide, please. So in terms of delivering the prize, we at APHRC have embedded these values within the prize process and implementation. We encourage collaboration. So because mental health is inherently interdisciplinary, and we see the need for us to really look at diversifying in terms of who is involved, to improve inclusivity and representation. So given the geographical diversity of the African region, the researchers from all regions across Africa in terms of the language being as inclusive, the knowledge of, or the need for capacity in terms of generating awareness for mental health or building capacity around data science, so making it as inclusive as possible. And we've already divulged to why we need people with lived experience. Previously, they had little input in terms of the addressing mental health problems, but we know the authenticity, the advocacy around it, and the unique perspective that they bring on board is key. And we need to be transparent, because progress can only be made by acknowledging existing limitations in the field and working together to resolve these problems. So being able to share our experiences across the board. Next slide, please. So I'll go through the key features of the prize in terms of the scope, eligibility, criteria, evaluation, the application process, and timelines. Next slide, please. So in terms of the thematic areas and scope of work, we are looking at, we cover depression, anxiety, and psychosis, but we are looking at three main thematic areas, that is data-driven insights, perhaps looking at how the brain, body, environment interact in mental health disorders, what works for whom and why. And this could be information that is drawn from, that is driven by data collected from either NGOs, civil society entities, and the learnings or practices about the effectiveness and management of those issues or best practices. There could be digital tools that can support mental health research and metrics. And it could be implementation science or implementation research that draws insights that can guide us to understand the cost effectiveness of different interventions, how to improve uptake, scaling, and generalizability of the evidence. Next slide, please. So we are looking at building the multidisciplinary research teams and supporting that through a platform, through our continuous engagement. And we're looking at individuals that are at any career stage. Applications led by early or mid-career investigators are encouraged. And applications are led by individuals that are based in Africa and are working in the African continent or context. And we also need to draw on the experience to drive and lead a research team addressing mental health. So any field utilizing mental health themes and conducting rigorous studies or analysis through observational or experimental implementation science qualifies for this. And this also covers startups and what you can think of as data-driven insights in terms of what I just mentioned with civil society or other organizations. So, and for us at APHRC, we will facilitate and coordinate the multidisciplinary team formation opportunities through our platform, through the engagement that we'll come up with, or the engagements we'll make during the capacity building program, and connections with interested organizations or researchers. We will support that. Next slide, please. So the lead applicant has to be based in Africa. I just mentioned that. Working in mental health or government agencies, research institutions, startups, private companies, and may collaborate with individuals from other countries. 80% of the funding has to come to the African-based institutions. The individuals must have some permanent, open-ended, or at least a contract for the duration of the award, which is the 12 months. Then we also envisage there will be multidisciplinary teams. So a team that might include data scientists, people with lived experience, decision makers as collaborators where relevant. And an individual may lead on one application, but researchers may participate in several applications as co-applicants. Next slide, please. So in terms of, most of these are available already online, but I'll just like to highlight a few things in terms of the ethical considerations and data privacy that we really are keen to make sure that participants understand the ethical dilemmas or considerations and data privacy issues in terms of we're looking at solutions that are innovative, embrace creativity, and out of the box. We're looking at impact, so the innovation or best practice or tool that you propose must make a tangible difference in the mental health of individuals and communities. We are looking at a transparency, so in terms of the whole process for us on our side, in terms of making it clear how you can apply, responding to your questions in terms of getting accountability for what we do, but also need for the way they conduct their research and embracing the values or align with the values that we envisage. We are looking at evidence-based solutions, drawing on established research and practices in the mental health field, and sustainability. So the solution or innovation that you propose, we consider the long-term sustainability of that solution and approaches that you adapt for it to to embrace a long-lasting or lasting impact on individuals, or even the use of that tool or solution. Next slide, please. So we are looking at collaboration from different stakeholders and partners, even within the teams that have joined today, or the teams as we go along, form partnerships and will support that. People with lived experience, those are affected by mental health challenges because of, and they provide unique perspectives and could be advocacy agents for the solutions that we propose, given the experience they have, and also bringing in the validity aspects of the tools that we developed. So we are looking at diversity and inclusivity. So we recognize how accessible some tools can be, and leave out maybe marginalized communities. So we have to look at welcoming. The proposed solution is welcoming to all, regardless of the background, has to be far-reaching and scalable in some instances. Feedback and learning is a continuous process for us during the capacity building, but also during the development of the proposals, and we will support that kind of engagement. Next slide, please. So in terms of the selection, so once the selection process is open, the application process is online, and the review process will also happen online. We have an advisory board or instituted that will look through the proposals. And at the first stage, we'll have a feasibility evaluation, whereby a panel from the APHRC team, a representative from the different African regions, will go through the proposals through this first stage, and then we'll make a review and scoring to inform the next stage. So at stage 2, we review the selection by an independent panel as well, represented by each region. And then the selection of participants at this stage will look at inviting participants to give a final presentation in the presence of the advisory board, the independent reviewers, and the team at APHRC, plus the experts and people with lived experience. So that diversity from our team will go through the final selection. So individuals who get to the final presentation will give their presentations, and then the final evaluation will be made at that point, and guided by the advisory board. So the evaluation criteria, as you look online, the detail is available there. So the different components and the proportions that are awarded to each of those methods, experiences, in terms of how much experience you have with either mental health or data science, the delivery and outputs based on the criteria I just explained, and then the engagement and collaboration, the multidisciplinarity of your team, the ethics and how you deal with that, and then the budgeting. So those that go through the first stage will have scored at least 65% to get on to the next stage. Next slide, please. So this I've already alluded to at stage 2. So it's building on from the previous, but also looking at the now more critically originality and innovativeness, significance, the rigor of the methods that you propose and their soundness, and the capacity building plan. Perhaps from the experience you would have gained through the capacity building, teams will be able to put up a good capacity building plans, and then demonstrating the value for money and equity issues around involvement, inclusivity, and diversity. Next slide, please. So the final funding decision will be made following the recommendation from the advisory board, and APHRC will announce the finalists based on the recommendation from that selection and the advisory panel. So I'll just go through the timelines shortly. And all of this has been posted online, so the details are already available. And before we open it up, we hope that the capacity building, and as we go along, you will be able to support the needs of potential prize participants or teams in terms of the delivery, in terms of developing their proposals and having adequate knowledge of what is required. Next slide, please. So data, we hope to provide some metadata access, but the important thing here for us as we develop the metadata repository is to be aware of the governance and ethics and safeguarding surrounding the use of data. So data will be accessed through several options. We are currently developing the metadata repository. We are searching existing data sets that provide information on, we have some, the previous prize provides some background data sets that we already in the process of preparing for you to be able to access the metadata from our platform. And the metadata is really describing the kind of data you can get from several data providers and the links to access that data. I mean, given the experience we have across the continent, we'll be able to support some kind of engagement or interaction with data providers. And they use your own data sources, data sets that focus on anxiety, depression, and psychosis, and strictly follow standard data governance and open science framework. And here we're looking at, making sure much as we have access to the data, we need to know what the ethics to be able to access different data sets. So it requires that data is collected fairly, stored safely, and not processed unlawfully. So applicants are expected to adhere to data safety and data protection policies within the countries in which they operate. And we also provide some grounding on and capacity building around the knowledge you require to understand what the data access issues and governance issues are. And in terms of the protection, how you can use the data, and what are the safeguarding principles that we embrace. And these same safeguarding principles and ethics and protection should apply to the research teams that we work with. And we highly recommend that the data access issues and data safety and data protection and safeguarding issues are really key on understanding the whole aspect around the use of data to inform policy, but also to inform mental health improvements while guarding against the limitations that exist in many of the data value chains. Next slide, please. So application, the prize application will begin at the end of June. There will be a link provided through our APHRC application portal. The teams will submit a written proposal through an online platform, and the guideline as you prepare will be available as an RFP. You go to the resources in our project website and read the detailed submission guideline. So in a short while, Eric will go over the platform currently as it stands to support the capacity building program. And there you'll find for the mental health data prize, once it's opened up, you'll find the proposal structure, the budget narrative, and the application form that is required to support those applications. Next slide, please. So in terms of the timeline, we've been going over, I think, a couple of months. I'm really excited that several people have registered for the courses, but we started right around November to develop our communication strategy with our consultant for the capacity building. We have a website and we had our inception meeting. So we had our first press release on 22nd December. That is the official announcement of the prize. And during this process of preparing for the orientation, we've been responding to questions, a few questions. We've been responding to needs, capacity needs of individuals. I gather many of you might have had the chance to go through the needs assessment and tell us or let us know what your immediate needs are in order to participate fully in the prize and also to receive the kind of support that you require. So while we have the orientation and Q&A now, we'll go through as we go along the capacity building program, which starts on February 9th. And this also involves the support for us to do the matchmaking and communication about the mental health data sets. So in July, we'll have the official announcement of the data prize, and then we'll open it up. We'll look at, you'll be able to look at the prize instructions, the application process, the RFP, and assess, and then we go through the process of, you go through as teams. So by that time, we anticipate you would have formed either your multidisciplinary teams or the required necessary skills, acquired some necessary skills to get you on board to make a very good application. We'll make the applications should close by the end of July, and then we'll have the assessment and eligibility and looking at the eligibility criteria, feasibility and evaluations. And then we'll announce around September 15th, October, we'll sign the contracts, and then we'll have an orientation and building up on the teams that would have received the prizes. To go over the 12-month period, we'll be able to provide some kind of support to develop the ideas and bring them to scale or actually have demonstrated impacts, and what kind of publicity and marketing needs to go into that, and the final pitches after the 12 months. So that's the timeline. Next slide, please. So we have our project team and structure. You'll have a chance to go over. We have teams from Mulusu, he's our project manager. We have the data scientists, epidemiologists, communications experts, and then we have the people on board and here supporting us with the capacity building, the grant management, and the finance team on board. And I would like to acknowledge all of these people in terms of us delivering on the prize and being able to leverage the expertise that exists on the team. Next slide, please. So in terms of the scoping, which I talked about, we are developing a repository of metadata for mental health data sets that exists in Africa. So this is a scoping of longitudinal mental health data sets, but it goes beyond just longitudinal. We think there are lots of mental health data sets that exist on the continent that have not been used or could be informative in many ways, could be cross-sectional, and one may use data modeling techniques to bring those data sets together to address the issues around the mental health disorders we are interested in. So we are currently going through the active search in different databases that exist online. We are identifying data repositories in the region to collect data sets for mental health and other data repositories. We are looking at international public databases, such as through the main libraries, to identify different studies that are ongoing, but we also identify healthcare service providers that have relevant data sets for researchers. And we also look at doing a passive search whereby researchers and experts doing work in mental health of ongoing projects can engage and support, at least provide the metadata that is needed for that kind of engagement, and perhaps also building on the data science skills, being able to bring large data sets into knowing or understanding the mental health problems. We have outreach. We are looking at outreach to organizations, institutions, both public and private sector, that focus on mental health, both for ongoing and completed projects. Given the paucity of data in the African region, we know that there's a lot of lack of understanding of the reality of the problem, because the absence of data conceals the advocacy and awareness that needs to go through to make improvements in mental health. Next slide, please. So, right now, we've gone through a few of the stages. So we are at the stage in March whereby we are looking at providing the screening and reviewing of the data sets that we have identified. And then along the way, we hope that during the end of March, between March and April, we'll provide an initial scoping of the metadata that's available across the continent for individuals with interest in using those particular data sets, or actually engaging with different partners to see how they could leverage those data sets, can reach out. We'll be able to do that. And then May, we also look at further enriching the existing data sets by reviewing those protocols and analysis that have been done, and then generating a report and releasing that report on our website. So develop and test the metadata set, and also looking at visualizing a sum of the outputs from that. So these mental health data sets will help us understand the need or the kind of tools that we need to develop. So we also, as I mentioned earlier, have the capacity building program, which was a need that is highlighted in the previous prize, but we also understand the challenges across the continent in terms of developing data science tools, data-related capacity, to understand the landscape that exists in the African region and what works in terms of improving mental health. So in that same spirit, we are looking at training, learning, gaining knowledge and skills, coaching, receiving coaching from experts in the field, and we are also giving support and looking at developing this support over a longer period of time. So this is support that will be available throughout the entire project period for anyone, because it's open to anyone interested in mental health research or data-related capacity strengthening. So the courses should be available on the platform. To engage and ask questions will be available throughout the entire period. So we look forward to engaging with you as participants, but also potential prize applicants, and are looking forward and excited to work with you to develop contextualized solutions for mental health. Next slide, please. So the course structure, I'll briefly introduce the course structure. Is really weekly webinars that are 2 to 3 hours from between 2 and 5 p.m. time in Nairobi. And there's also self-paced material that is available online that you can access prior to the courses or during the entire period of the application process. And the courses start on 9th February. We look forward to you engaging and encourage you to join the capacity building program. And depending on the need that you have, we are also looking at you helping us fill in the evaluation forms for the course, because this helps us make the delivery of the courses better, helps us to know what's missing, what we need to clearly articulate, and what your challenges might be, and going forward, how do we improve the engagement that we have. So we encourage proactive participation. So by going in there, you will be able to access the platform anytime when the courses are launched. And right now, some self-paced learning materials are available. So we look forward to understanding, but also to supporting and learning through the process, learning from each other and the expertise you bring on board. Next slide, please. So in terms of the program, and I'll leave this to Eric, then the next speaker, to speak through the program, but we have the basic or fundamental introduction concepts around mental health and data science. We have basic statistics courses. We have advanced statistical analysis. We have machine learning algorithms, and then we have evidence-informed policy decision-making and how this relates to mental health. So we are really looking at your participation, your involvement, because this helps us build the community of practice around the support that we need to build data-related capacity around across the continent, which is key for us to deliver better solutions that are contextualized in our setting. So next slide, please. So I won't go in detail over the particular courses, but I would like to let you know that in case you have questions, please post all your direct questions about this initiative to those addresses. This presentation is available online. You will have access to it. And for any individuals who haven't been able to be part of the live session, they'll have access to it. We have a website, we have social media engagement platforms, and we are also posting together with in partnership with our comms teams, and looking at weekly engagement and focusing on the outputs and key questions or highlights of the week in terms of whether it's on our Facebook, Twitter, or LinkedIn web handles. We hope to engage with you through that platform, but also through our website, because we have a collaborative engagement provision in that. So I'll hand over to Eric, who is going to speak through the platform, how you access it. Thank you very much. And thanks to the participants. Over to you, Eric.
Good afternoon, good evening, everyone. So I'm going to share my screen. I hope you can see me. I'm going to share my screen right now to take you through the platform. You can see my screen, eh? Yes.
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 Go ahead.
Yes. So this is the main page. This is the landing page. The domain, the subdomain is mental health datapriceafrica.aphrc.org. So once you visit this subdomain, then you will this page will load. So then once you are on this page, then you click on this top menu. We have capacity building. So this is the program website link to the website. So you click on it. It will load this now website. And this is the home page of the website. But before you even browse, you might need to log in or register if you are not registered already. How to do that is using this menu on the right, is login if you have an account, or register if you don't have an account. And I'm going to demo briefly here using this account. So it's your name, the email, then the country where you are registering from. Then you click create account. So an account will be created and an email will be sent to your inbox with further instructions on how to set your password. So if I go here, the email is already here. So this is it. So you click on activate now. It will load this page, which will ask you now to create your new unique password. So I can create a new password, and now I'm already logged in. An account has been created for me. So, and the system will automatically log you in. So next time you come to the site again, you want to log in, you use your email, which you use to register, and also a password which you created. So this is the home page. We have many courses listed here, as you can see, and they are grouped according to categories. Like now you see data science. We have these many courses here. These are the top, the latest courses on this particular category, data science. You go to another category, you can click view so that you can be able to browse all the courses from data science. Mental health, you have the top course, the latest courses. You have artificial intelligence, you have the courses here. Evidence-based policy decision making, you have the courses here. So these are just the latest courses on each of the categories. But if you want to see or to view all courses, then you can use this link here, courses on the menu still. It will lead you to this other page now with additional features like filtering. You can filter the courses based on the category you want to search, or you can as well filter the courses based on the language you want, which languages are these courses being offered in. Right now, all the courses are in English, but as we go on, maybe we'll be having courses in different languages. So you can filter using these left sidebar menus. These are you can click, once you have filtered, you have searched the course you want, you can click on it to view the details, or you can as well search the course per keyword. This is text-based search. So you can type anything here, then you will click search, then the system will search for you. If such a course exists, then it will be displayed. So once you have found your course, then you can click on it so that you can be able to view additional details about the course. So this page will load. It's the title of the course, a brief description, when is the course starting, the duration, and the course is, which language is the course being offered in. So you'll have that information at the top part of the page. Then below the page, you have now details about the course. Like about the course, you have the details here. You will navigate using the left side menus. Course objectives, you'll have the description here. Course content, you'll have the description of what we'll cover in this course here. Then the instructors. If we can have many instructors for a course, so all of those instructors would be listed on this page. And you can click on the image or the name to view additional details about the instructor on the PHRC website. So this will load the PHRC website and you can read more about the instructor. So if the course is open, like this one now is already open, so you can click on start course. So this one will take you, okay, let me use another course which has some content in it. This one is still being updated with content. So let's use this one. So it's the same page, same details for different course. So start course. So once you click on start course, then you will land into this other page with the materials now. For example, this course has these many sections. We call them chapters or sections. Then under each chapters, we have these many topics. So you click on any of the topic, then the material will be listed on the right. So you can navigate forward or back using the menus on the top of that particular, of this page. So you can see this is the introduction. We have this content here. Next, this is content still, but in form of a video. So that is for this is the two subtopics for this particular topic. So you can go to the next topic, this next chapter, Then inside the chapter, we have a topic called study design. Then you'll have the content here. Then you can still navigate using the top menus here. So the course will be loaded with materials as we go, and all these sections will have materials in which you can interact with here. Then on this same page, you can be able to monitor your progress. Here, this particular section of the page will show you how much of the material you have gone through or you have read. So it will show from 0 to 100%, depending on how much of content you have interacted with on that particular, from this particular course. Then we have another subsection here we call collaboration space or collab space. This is where you can create groups or collaboration spaces with other learners talking about this course or taking this course. So for example, for this course, we have one collab space which has been created and is called Depression in Kenya. So you can click on it. This page will show you the members. You can join that space. So once you have joined the space, then now you can begin discuss with your team within this particular space. So if I click here, so you can start your topic, or if the topics are already there, they will be listed here. For example, if I click here and I want to start a topic, a test, just an example. Submit. So this topic will be created and it's here. So you can click on it. So this is it. So you can add a reply. Basically you can discuss. This is like a discussion thread. It's like commenting on this particular post or topic which this user has created. So it can go on and on. So, but within that particular collab space only. So you have to be a member of that space for you to be able to post or to create a topic or to interact or to discuss on any topic. You have to be a member of the collab space. So you can discuss or you can collaborate on text. Now this is a real-time collaboration on a text document. So this document is available to all members of the group. Any one of them can write or can edit it, just like the way Google Docs does. So one document accessible to many users, and those many users are editing the document real time, and everyone can be able to see the changes being made by the other members. So you can do that one within the collaboration space. Then we have another tab here for discussion. Now again, just like the collaboration space, we have a discussion space now where you can discuss anything about this course with other members who are taking or who are doing this course. So it's the same way. You can create your own post. Then once you create that post, others can come and comment on the post. Others will leave replies to the post. So, and the discussion goes on and on. Yeah, so that is the platform as it is right now. And as you can see, we have many courses and the courses are being updated on daily basis. So anytime you visit the website, you'll find more content being loaded and you can begin interacting or consuming the content. Yes, I think that is it from this end, Mlusu.
Thank you, Damaso, Sylvia, and Eric for your informative presentation about HRC, the detailed data price structure, and also how to sign up for the course. So now is the time for Q&A. If you have any question related to data price or any general question you can raise, or you can, we will try to respond to your question in the chat box. So Joel, can you look at those questions and we will respond to it?
Yes, so most of the questions are first of all on how the groups are going to be formed. So individuals would like to know how the teams are going to be formed and how many, the number of individuals in a team. And I see Damaso was answering some of them, but kindly you can address them for those one who did not see the chat. Over to you, Mauricio, please.
Okay, if the question is all about team formation, first of all, I would like to emphasize that this mental health data prize is not an individual call. If you are an epidemiologist or economist or data scientist, we would like to encourage you to create a multidisciplinary approach. As all presenters have presented, the issue of mental health requires thinking out of the box and requires an approach from multidisciplinary. Therefore, we encourage you to form a multidisciplinary approach to the condition, the three, especially the anxiety, psychosis, and depression conditions. So in case as a PHRC, we'll try to like facilitate matchmaking exercise. There are some 3 or 4 sessions that we will arrange in between, like a kind of digital matchmaking. Suppose, example, if you are a mental health expert, but you don't know about data science, we will try to match you with someone who has a good experience about who is interested and also has an experience in data science, etc. So there is a digital matchmaking exercise that we will arrange in the meantime. In terms of the number of, there's a question about the number of team. It depends on your the question you have, and that depends on the kind of disciplinary you want to answer your question. But one thing I want to emphasize is about the engagement of key stakeholders. When we say key stakeholders, we would like you really to focus on these people with lived experience, people who have mental health condition, have an experience, and they have some views about your digital solution or your views about data-driven insight. So we encourage you to involve them at any stage of your proposal for your project development. So that is the must to-do criteria. The second is about the other end users are, policymakers. At the end of the day, the users are the policymakers and also the mental health community. So involvement of the policymakers and the other mental health community into your project is really is crucial for you to win this prize. I don't know if I have answered your question. Maybe Damaso or Sylvia, if you want to chip on it.
Yeah, okay. Yeah, thank you very much, Mauricio, and it could be any other members of the team who are here that can respond to some of those questions. Yeah, an attempt has been made to respond to some of these questions. So in terms of teaming, it is not our intention as the project leaders to form groups, to help people form groups. But like Mauricio has said, we can facilitate the matchmaking. So some people were asking whether we can form a WhatsApp group, but we are not going to go into those details. So, but at least through the capacity building program, while we are when you are attending the courses, you will have the opportunity, of course, to interact with the members who will be participating in all those programs. You'll have the opportunity to know who is working where, and you can definitely reach out to make your own networks, make your own collaborations. So as an institution, we can only maybe, like Mauricio has said, provide some, some guide on who is who and which individuals are working on what. But we are not going to form teams. So the teams will be formed by yourselves or by individuals who are interested in responding to the data prize. That is the number one. So you have the freedom to form teams within the same institution where you're working, within the same country where you live or where you work, or even within the same country and outside that country. So it could be the same institution, it could be different institutions, it could be the same country, or it could be different countries. So you don't have a limitation. In terms of the number of people in the teams, that is again up to you. Of course, there is a budget that Sylvia has talked about of 200,000 pounds. You have to make sure that this budget is the members you put in the team have roles and responsibilities on your project, and each person has a role to play, and that there is clarity for that, and that the teams fit within the available budget and in your activity plan. So whether you are 7 members or 100 or 3 or 2, that is completely up to you, of course, in line with the available budget and the activities that you need to do. The other point is in terms of the number of courses that an individual can do. That is also another question that I saw there. Number of courses, you can do as many. It is our preference that you attend everything. You can do as many courses as you can. These courses are going to be recorded and they will be available virtually. I think, Mauricio, you can clarify if I'm wrong, but I think if you are not able to attend the live presentation where you can be able to ask questions, I think these the sessions will be recorded, and you should be able to come back to the recording and review and listen in and be able to follow the number of courses that you have that you would like to attend. So I think that is for now what I could have answered. Maybe if there are other questions, okay, and all my colleagues could. Yes, somebody was asking whether we are going to give certificates. It is not our intention to give certificates for these trainings, but Mauricio, you can correct me if I'm wrong there. But because usually the certificates at APHRC, my understanding is that if we are going to offer certificates, we have to provide much more monitoring to that particular effect. But this is a virtual undertaking where we are providing capacity building on how to approach, or get more information or evidence on different mental health conditions or outcomes, and that these courses are taken for purposes of enriching you as individuals or as applicants, for those who will apply and be successful, and even for those who will not be successful. So it is an open kind of engagement, but it is not our intention to issue certificates. But should there be a need, I think we still have a freedom to touch base with our leaders at the institution, and especially those who are responsible for the training unit, to advise us. But at least at the moment, that is not a plan. Lastly, Mauricio, is that some people were asking for the link to the website. So there is a link, I typed it there. So in case members have not seen it, please check in the answered questions. We typed the link there. I want to pause there for now, and maybe my colleagues can add on.
Kindly also address a question about if people can partner with individuals who have not participated in the capacity building program.
Yeah, just one thing I want to mention is about participating in this capacity building. It's not a mandatory. Also, it's not a precondition. Also, it's not a criteria to win the prize. It's to build, to enrich you, and to let you know that where is the gap in African context, where is the mental health data, mental health research and the gap in African context, so that you will be able to develop your protocol. Definitely, your engagement, your involvement in this capacity building program will help you to develop your protocol. However, you can still engage with those people who do not participate in the capacity building program. It is possible as far as you bring a novel and innovative solution to this mental health condition.
Thank you. There's also a question about if individuals, after the application process, if they'll be waiting for an interview.
Yeah. Oops.
Okay, go ahead, Sylvia.
Yeah, so I think we have 2 stages in there. The last stage is the one that requires the interview, but the other stages will be based on what you submit through your application and will be reviewed by a panel of experts. So I hope that's what they mean. At the last stage, we'll be able to interview the participants.
the last stage, the interview one, is you present like your project, and then there are panels who will ask you specific questions related to your project.
Thank you. We also have participants who are asking about if they will be facilitated with funding for such as interviews like data correction.
Interviews. I think we have, I probably think we have all mentioned that we are looking at using pre-existing data. So I anticipate in the focus would be on either you have a data set, you've collected data, you're using pre-existing data, or you can actually access, engage with a team that has data that may address your questions. Because we have a lot of data that is not used, I would encourage that the key focus should be on pre-existing data sets, because we leverage the skills, the amount of time, the learnings across the process. Yeah, Akin, over to you.
Thank you, Sylvia. I just want to really highlight that because I think I've seen it somewhere in the Q&A session as well. The data prize is very much using the data sources that already exist, and it cannot be used for new data collection purposes. So that's out of scope. However, whatever interviews you are proposing, if it relates to, I don't know, integrating lived experience perspectives or whatever, like to the design of your project, I mean, that's a different question. But yeah, just to make sure that the price is not, the kind of new data collection is out of the scope for this price. So.
Maybe just also to say the courses, the training courses are all free. They are open, so anyone can go in and access them at any time during the duration of the prize. Yeah, so they're absolutely free and they'll be open throughout the entire period of the application. Over to you, Joel.
Okay, I think those are majority of the question. But there is also a question if they can work with individuals across countries.
Yes, there is no limitation on how many across the country or within the country. So you can work with multiple countries or whatever, as long as you a multidisciplinary team, you meet all the other criteria. There is no restriction on number of countries or whether you work internally or externally. Absolutely.
I just wanted to add a comment. So the courses, like Sylvia has mentioned, are open, and the people who are listening in today were not pre-qualified or maybe selected based on either academic background or something like that. So everybody who registered to participate in this capacity building program is here. Anyone, you could register as an individual, you could register as on behalf of your institution, and even if you missed one course, you can actually, that does not stop you from attending another course. So feel free to go ahead and register and attend as many courses as you can. So I think this is, like Sylvia has just said, this is an open platform where we are offering a number of tools and some guidelines to help us analyze or generate evidence from data which focuses on mental health. This is really this is fundamental in a sense that like Mursi has explained, we are not offering the capacity building program for purposes of getting the grant. So let us not, I think that should be made clear. We are not offering the capacity building program for purposes of getting the data prize. Rather, we are saying we don't have enough resources. We can only offer 10 prizes, but we are saying there are several people outside there who have data and who can generate evidence from their data sets for purposes of programming, for purposes of informing policy, and for research, and for everything. So we are saying let us offer the capacity building program to anyone who is interested, so that at least they should be able to use this knowledge obtained, whether they get the data prize or not. So I think that should be made more clear. Over and back to you, Joel. I think so.
I think we have addressed most of the questions, but in case there are questions that you feel were not answered, we are going to pick all these questions that have come in, and we are going to put them in the Q&A section of the website. So kindly follow the link that we provided, and you will be able to get answers to all the questions that have even been raised. Over to you, Morris.
Yes. Thank you, Joel. Just to make a final remark, can you go to the final slide, Joel? Yeah. I want to remind you that the course will start on the 9th of February. That means this coming Friday from 2 to 5 East African time. We will walk you through introduction to the mental health conditions and research in Africa, globally and in Africa, and also we will discuss about what kind of data gaps are there, and also technologies are there for mental health research. So please join the course. The other is this course will last up to it is for 5 months. Will last up to June. In between, we will have a matchmaking exercise that will help you to build your team. In terms of especially matchmaking exercise, one of the features that we have created on the website on collab spaces, you can create your own closed collab space in the website. Like if people are, from example, from Kenya, the team can discuss the closed discussion. Nobody will see your discussion on that platform. You can team up on that platform and form start discussing about your concept, etc. But you can also use different platforms such as WhatsApp, Telegram, and create your group, including Slack, and create your own group and start building your idea, incubate it, grow it. You have 5 months from now on, like to bring innovative solution to these mental health conditions. So again, we'd like to remind you that the prize will open on beginning of July. And if you have any questions related to the data prize, please reach out to us using the email provided. And also please visit our website. Unless we have more burning question or any comment from our partner from Welcome, I think this webinar or this orientation will end here. And thank you for joining this orientation. Maybe Ekin or Winnie, if you have any final remarks.
Hi, no, not really any final remarks, just to say it's really fantastic to see so many people online, and we're so grateful for having APHSC, such a fantastic partner, and we hope to get some amazing research programs out of this. So we're very excited about this. Thank you very much.
Thank you. Thank you very much. And thank you all. Have a good afternoon and a good evening. Thank you. See you on capacity building program.
Yeah, thank you so much. And see you the next capacity building meeting. Over.